Okay, I'd like to call this Board of Health monthly meeting for Monday, March 8th, 2021 at 4:30 to order. Amy, could you call the roll, please?
Danielle Chenoweth,
Present.
Andy Cornstrom,
Present.
Darlene Couple.
Present.
Next, we have approval of the agenda and any additions. I did want to say that I think there's a discussion item for the non-compliant food establishments, but we don't have any documentation in the packet. So do we need to discuss that this evening? I mean, I guess we can leave it on the agenda and get to it, but I just wanted to note, I don't think it's ready for action today. Any other comments on the agenda or any changes?
Motion
Okay.
to approve.
We have a motion. Is there a second?
Second.
We have a motion and a second. Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Couple.
Yes.
Next, we have approval of minutes of the previous meetings. We have both February 8th, 2020 monthly meeting and February 24th, 2021 and February 24th, 2021 study session. I entertain a motion.
So moved.
Second.
Do we have a motion and a second? Any discussion or changes? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Couple.
Yes.
Next, we have public participation. Is there anyone here who would like to address the CU Public Health Board this afternoon? If you could raise your hand, or you could also speak up. We're a small meeting. Seeing none, we'll move on to correspondence. Julie, did you have anything for us?
She was doing an
Sorry.
interview.
I think you probably already heard today that the CDC came out with their guidance for vaccinated people, and that's encouraging. So basically it means if you have people and they're all vaccinated, they can start gathering inside together. So that's hopeful. We're up to over 21.44% of eligible people in our county are vaccinated, fully vaccinated, and about over 30% have their first doses. We don't have any of the Johnson & Johnson vaccine yet, but we think probably in the next couple of weeks we should get some. And that will make our numbers go up even higher because, of course, with that, one shot and you're done. So you're fully vaccinated. Let me think, is there anything else? Can I mention the study, OASE? Or is that, yeah, okay. There's a National Institutes of Allergy and Infectious Disease study that the university is participating in, and CUPHD is assisting with that. We will be doing some of the recruiting and the outreach and testing and various things that go with that. The name of the study, hold on a minute, let me call it up here. It's a randomized control study to assess SARS-CoV infection, viral shedding, and subsequent potential transmission in university students with Moderna COVID-19 vaccine. So what it's doing is going to look at, it's going to take a group, get them vaccinated, and then they're going to get daily testing to see if they have, they'll obviously be protected from COVID-19, but the question is, can you still spread it, through your nasal pharyngeal area? So we will find out from that study, hopefully. And it'll take a total of about 7 months, it looks like, to do that. But that's kind of exciting. For those of you who don't geek out over every little thing, public health, a National Institute of Allergy and Infectious Disease is the agency that Dr. Fauci runs. So we're kind of tingly to even be associated with that in some way. And that's working with Joanna Schisler over at the U of I. So she's a virologist. So that's pretty exciting.
Great. Any questions for Julie? I just noticed when I got tested this last week, I was the only person in line testing. That seemed like a good thing. I got tested before the second dose so that when I freaked out and felt like I had COVID, I would know that I didn't have COVID. So that was also successful. And I will report that it was about a 2.5 day recovery for me, although I tend to be sensitive if you all haven't figured that out already. So
Mine took about 18 hours of, and my colleagues, younger and older than me, got vaccinated same time, same vaccine. They were fine, but I was really surprised, but it definitely felt like, flu for a
Yeah.
good 18 hours, and then I was fine, but yeah, that's
Oh, so
definitely better.
I'll also say I was vaccinated both times at the Dress Barn, and it was a beautiful, well-designed and well-structured, completely professional, hundreds of people in the space. It felt very safe. It was very quick and efficient. I am extremely impressed.
Yeah, this county, we can do our vaccination clinics. If they had given us 230,000 doses of vaccine all at once, we would have had everybody vaccinated in a week. So, but
That was pretty clear. Yeah, well done. Any other comments or questions? Okay, so we'll move on to, there's no old business. We'll move on to new business and the treasurer's report. Rotten.
Hi. The treasurer's report as of the end of January 2021, we've got cash on hand to just over $4.5 million and a fund balance of just over $5.5 million. That's about 30% of the overall expenditures for the year. So we're well in line with the 25% guideline. For the seventh month of the fiscal year, we have a surplus of $840,792. That's a bit more than what we budgeted for, but I think it's a timing thing with the way the money is coming in this year. Total revenue is $9,444,000. That's about $1.5 million under the budget. Again, that's just the way mostly grants and contracts have come in, but the expenditures have stayed in tow with the same timeline. As they're at 8.6 million, they're at 2.3 million under budget, and that's what's left us with the surplus at the end of the 7 months.
Sorry, great. Any questions for Ron? If not, I would entertain a motion to put the treasurer's report on file.
So moved.
Second.
Motion and second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Klippel.
Yes.
Next, we have approval of payments to the Board of Health appointees to Treasurer Ron Fields in the amount of $210 and to Attorney Ruth Wyman in the amount of $2,275, and entertain a motion to approve both.
So moved.
Second.
We have a motion and second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Klippel.
Yes.
Next, we have the credit card statements. Any questions about the credit card statements? I don't have any.
Or do I?
Okay, I would entertain a motion to put the credit card statements on file.
So moved.
Second.
Motion is second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Klippel.
Yes.
Next, we have approval of payment to Vasquez Construction, Inc. for the basement renovation in the amount of $75,630. I'd entertain a motion.
Danielle, can we take items number 4 through 8 and make a motion, omnibus motion together? They're all approvals of payments.
That is a great idea. So we would add approval of payment to Kemper CPA Group LLP for audit services in the amount of $11,000. Approval of Comfort Suite invoice in the amount of $26,039.23. And approval of check request payable to ASD Healthcare for birth control medication for teen and adult services in the amount of $5,672.08. And approval of invoice number 9708 for 2021 annual membership to the Champaign Community Coalition payable to the city of Champaign in the amount of $5,000. I'd entertain a motion.
So moved.
Second, and I'm so glad Darlene's joined our group. This cuts things in half.
Yeah, I'll in the future make a little tie them together on the agenda the best I can. So we have a motion and a second. Is there any discussion? I just have a quick question, and this is of the Champaign Community Coalition, what Julie, you've seen the outcomes of that investment in the last year as a member?
Well, I mean, honestly, I've been to some of the meetings, but I've been so involved in COVID that I haven't been to the meetings like I usually go to. But they're still plugging away on stuff. I think that our 5,000 goes towards helping so there's what is it called? I'm totally drawing a blank. The stop shooting program, whatever that's called.
Fresh Start.
Fresh Start, good God, can't even think of that. Yeah, so there's that part of it, but then we also have money going into the programs that are the prevention type of programs. And I believe that is where our funding goes to. There's a bunch of different programs that they fund that's available in the annual reports and the minutes and everything. So that's mostly where that's going. We have also contracted with them, that group, to help get out youth content so that the kids could put together messaging and TikTok, whatever they're called, TikTok videos, I guess, and help us get messages out to that age group about COVID related things.
Okay. Yeah, and I know that gun violence and violence was addressed in the I plan. So it'd just be helpful to kind of understand, since we fund this program and we don't necessarily fund other programs in the community that are also doing things, just having some clarity about why this investment and other investments, and being able to articulate that clearly would be helpful.
Well, I will tell you that after the pandemic, we're going to probably start talking about ways that we can work with a lot of other, basically, if it's something that's in our I plan, it's to deal with the structural problems is what we would like to do as a health district, start dealing with some of the underlying problems that are connected to everything that we deal with year after year after year, whether it's gun violence or, mental health, behavioral health type of stuff. We certainly don't want to do that, those services, but we want to be a part of having a really, kind of like we're doing with the pandemic, bringing together resources and getting them to pull on the rope the same way and address things. And it's something that we've talked about, is being able to actually be able to put some money towards some of these programs and use that to leverage additional funding, like, grants, be they federal or foundation or whatever type of grant. So that's kind of where we're looking. We're already peaking beyond COVID. And that's one of the things we don't want to squander this, all this cooperation and everything that we've been doing. Part of it that I think has been an amazing and really surprising thing to me is dealing with the business community. That's just something we never really had done before. And, that's a really creative group, and they are connected to all kinds of stuff. And I think if we keep the units of government and all of the CBOs and public health and everybody, and we apply this same effort that we're doing to COVID, I think that we can actually move the needle finally on some of these community problems that we've all been dealing with for a long time.
Mm-hmm.
So that's my fantasy hope right now moving forward. But I've already started, putting this out there to putting us out there to some of the foundations, and so as always. But we're going to be able to show at the end of this how our county worked together to really succeed. Well, now,
Mm-hmm.
I guess it's succeeding. I mean, people still died, but it will be we will show that everything that we have done in this community worked and why it worked, and then be able to make the case that we can use that exact same strategic planning for other issues and hopefully get some of this stuff taken care of.
Yeah. One of the things I've seen us do very successfully is to partner with organizations where we have longevity and credibility with the state to pass through dollars to nonprofits in the community. And so And, you know, those organizations with potentially support from CUPHD are going after grants that pass through. And then we have sub-grant recipient agreements with very clear measurables around what is expected for those grants. So I think that model is really good. And I also know that, and I can, you know, as it's helpful, share at Township that we're restructuring our grants process so that instead of peppering dollars throughout the community and in ways that I can't really, you know, I can't honestly account for, other than I know that they have a clean audit and they ran that program. But in terms of how does it extend the services of Township, that logic has not been in place for a long time, and I inherited that program. So we're restructuring it to really have clear benefits come out of those dollars. I know this is a small amount, but I just think I would, you know, I'd like to see more partnerships, not less. So I agree with that, and to have a structure for it that is, you know, that's tied with certain deliverables, I think would be helpful. So
Yeah, and one of the things that we need to do in this community too is to put together, and that may be, you know, we may do that at some point, but is put together workshops so that, well, actually the county would probably be good at that too, but putting together workshops to help some of these CBOs and little groups to get GATA compliant. It's a huge
Yep.
pain in the butt. It takes a long time and you can't wait and do it like, oh, here's money available. It's too late then. You have to work on it ahead of time. You have to work on your board structure. You have to work on understanding, you know, the things that are going to be required of you. Probably a year, 6 months at least in advance. So that's something we could look at too.
yeah. Yeah, we have money that's left on the table at the state and federal level for various reasons, and that's one of them. So any other discussion on the omnibus motion before us? Okay, if not, roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Now you see, Andy, I just squandered all that time that Darlene saved you. By
Yes,
hammering.
but it was informative, so it's worth it.
It was content. I don't think that's considered squandering.
I don't think the point is getting done as fast as we possibly can.
So the next is a discussion item of House Bill 3447, reducing barriers to recovery. There's some information on page 36 of your packet. Is there somebody who's been speaking to this on the staff side?
Well, I'm really not ready to. I sent it out because I wanted you guys to see it. It is something that absolutely, you know, CUPHD is for that. Because I'll give you kind of the gist of it. It's to, it's basically, if somebody has a drug conviction, it's not to ruin their life for the rest of their life. It's to, you know, if they have an offense like that, then when they're done with whatever their punishment is, to be done with it, not to, you know, not to make it so because they're a felon, they can now no longer get housing. They can't get jobs. They can't get, you know, everything like that. And it's because that just perpetuates the problem, as you probably all know. So it's to look at that. And so I just wanted to give you guys a heads up. We can certainly get somebody in here to talk about it at some point. But it's actually sponsored. I got contacted. Who contacted me about that? I can't remember right now, but anyway, it is a locally sponsored bill. Carol Ammons is one of the sponsors. I don't know if Senator Bennett's going to be on there or not. But I just wanted to put it in there so you could see it. And it is something that I would like us to support. And then at some point, if I get called to testify, which I don't know if they're even doing that right now, but then I would want to do that to explain how that fits into the upstream public health, you know, prevention, mental health, public health, everything, because it all just leads to further, you know, poverty and escalating problems. One person's drug offense and the long-term consequences of that can ruin an entire family. So as you all know, I'm sure. So.
So the question is it, yeah, you can do that. I looked over the documentation and I was aware of this House bill as it's been moving. I was just looking to see if I had the latest in terms of what its status is before the House. And I don't see that. Oh, here it is. Yeah, it's,
For whatever reason, if I get called to testify about something, it's usually on the Senate side. I'm not sure why, but
mhm. Yeah, so I guess
maybe once it gets there that,
would it be helpful to, move that we submit a witness slip, or on behalf of the Public Health Board in support of this House bill? Because we certainly could do that. And if the board would like additional information before doing that, I could reach out to Rep. Ammons to get that.
Are you looking for a motion? I mean, I think conceptually, I, for one, support the legislation, and we don't expect it to change with any great extent, do we? I mean, I know that negotiations occur, but
I wouldn't think it would, because it's probably like either you're for it or you're against it kind of thing. I don't know.
Yeah, witness slip would just say that you're for or against it.
Yeah, it would just be and CUPHD will submit as the agency, like we're a proponent of the bill. But I did want to give you a heads up in case at some point I'm asked to come in and give, examples of this. And I can assure you, I would talk to certainly you two at Township to get some examples, because I know you probably have plenty of examples of this. It really impacts housing a lot. I mean, we have had over the years with a lot of our clients, we've had a lot of problems with that. Even, our HIV clients back in the day, that was a huge problem.
I think you're
Yeah.
talking to the choir here, Julie.
I know, but I wanted, I know you all, oh, of course, and Darlene, maybe not so much at the county, but obviously you know about it from your previous job. So, yeah, I mean, I know, but I wanted to put it out there, and then if I'll keep sending you information as I get it.
Okay.
There you
I
go.
would just make a motion to submit a witness slip on behalf of the House Bill 3447 as the CU Public Health Board. Also, the administrator you can submit a witness slip as well as Public Health, but we would submit it as a board.
Okay.
second.
A motion, a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes.
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
So I'll make sure that a witness slip I'll check with Rep. Ammons to see what that would be appropriate. And if there's any major changes to the legislation, I'd let you know. Next we have, I lost my place. Hold on. Discussion of the fine structure for non-compliant food establishments. And I think Ruth has just joined us. Ruth, I think you're on mute.
Sorry. Hi, yeah, sorry, I just got out of court. We had done some discussions with my notepad about the fine structure. I'm still working just to try and get something that's going to be legal, because I've not.
Please do.
Yeah, and so perhaps I'm just trepidatious to make sure that we have all, I's dotted and T's crossed. And so I apologize for not having the draft to you. If we can, I've got still the notes from last time from our study session. So if we can put this to the next study session, I hope to have something, a concrete in front of you guys to look at and to make changes to, with the idea that it would then be passed at the next meeting. I have seen, when I've gone out, I've seen some stores having signs up saying, please wear masks, otherwise we're going to be fined. And so at least the messages that CUPHD is giving seems to be getting out, or at least people are taking that seriously, which I think is a good thing as well. But I'll plan to get you all something on paper, or at least in writing, to make some changes to it for the next study session.
That sounds good. Any questions for Ruth or comments on this discussion item? Okay, thanks, Ruth. Next, we have approval of application and FEMA Public Assistance PA grant agreement to cover costs associated with COVID-19 vaccination efforts at the Ihotel and Conference Center. Entertain a motion.
So moved.
Second.
A motion and second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Next, we have ratification of the professional liability and malpractice insurance renewal effective February 27th, 2021. I'd entertain a motion.
So moved.
Second.
We have a motion and a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Next, we have two rental agreement and a sublease agreement. I'll go omnibus a la Darlene's suggestion. Approval of the rental agreement between CUPHD and Daniel J. Mundy and Jacqueline S. Mundy as trustees of the Family Trust of Daniel J. Mundy and Jacqueline S. Mundy for office space at 2003 South Banker Street, Suite B, Effingham, Illinois, for the period of April 1st, 2021 through March 31st, 2022, in the amount of $450 per month. And then also the approval of a sublease agreement between CUPHD and Rosecrans Inc. for office space at 1222 East Voorhees Street in Danville, Illinois, for the time period also of April 1st, 2021 through March 31st, 2022, in the amount of $350 per month. I'd entertain a motion.
So moved.
Second.
The motion is second. Any discussion on those two items? If not, roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Next, we have pending subcontracts and agreements for the chair to sign. CUPHD East Central Illinois HIV Care Connect and Carl Foundation Hospital to provide services to individuals living with HIV. CUPHD and East Central Illinois HIV Care Connect and Carl Care Inc. doing business at Carl Physician Group to provide services to individuals living with HIV. CUPHD East Central Illinois HIV Care Connect in Hoopston Community Memorial Hospital to provide services to individuals living with HIV. CUPHD East Central Illinois HIV Care Connect and Rafi K. Bijan DDS LLC to provide services to individuals living with HIV. CUPHD East Central Illinois HIV Connect and the Greater Community AIDS Project of East Central Illinois to provide services to individuals living with HIV, and CUPHD East Central Illinois HIV Care Connect and Kevin Elliott Counseling Group to provide services to individuals living with HIV. And lastly, CUPHD East Central Illinois HIV Care Connect and David No DMD to provide services to individuals living with HIV. I'd entertain a motion for those items.
So moved. Second.
Do you have a motion, a second, any discussion? Roll call, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Next, we have, I'm trying to get to the bottom of this. Grants for the administrator to sign. Hold on. Get through all of that. I'm trying to get to the bottom of the grants.
I don't think do I have any on there, Amy? I don't
No,
think-
we just kept it on in case.
Okay.
No, there's no-
Okay,
Oh, okay, good. I'm like, I actually have two versions of it open and.
we
that was-
keep that on there because one could literally pop in, today,
Okay,
this
good.
afternoon.
Right. So
So,
no pending grants, contracts, thank you. Our next meeting, it sounds like we'll have a study session to discuss the fine structure for non-compliant businesses on March 31st, 2021 at 10:30 a.m. And then our next monthly board meeting is April 12th, 2021 at 4:30 p.m. And I would take a motion for adjournment.
So moved.
So a
Second.
motion and a second, any discussion? Just a heads up before we adjourn that I am taking vacation from March 12th, basically through March, I think it's 21st. I will not be touching or looking at a computer during that time. So I'll send you a message, Julie, and to Amy and others, and just, I think, Andy, you're able to approve contracts in my absence, correct?
I believe so.
Okay, so yeah, there may be, make sure that Amy and Mandy and others are aware that I'll be, and Pat and others are aware that I'm out during that time and I won't be online. But before and after, I'm happy to take care of those. All right, roll call for adjournment, please.
Danielle Chenoweth,
Yes?
Andy Cornstrom,
Yes.
Darlene Kleppel.
Yes.
Okay, thanks so much. Have a good evening.
Thank you.
Danielle, I have a question before you go.
Yeah, sure.
Is it routine that we would have a study session in the middle of, in the end of the month between on Wednesdays? Is that usual to have a study session at 10:30?
It's usually scheduled for a study session at that time. I would say that maybe 4 times a year we use it, but we schedule it every month in case it's needed. Is
Okay,
that a
so-
conflict for you, Darlene?
Well, it's always that time on Wednesday at 10:30. I'm just checking to make sure I get it on my calendar.
Yeah, absolutely. So I go ahead, put it on the calendar, and then basically at the meeting, we usually are aware of whether or not we'll need a study session.
Okay, thanks.
And then if for some reason, you guys can't do it, then we can also, within the 48 hours, we can reschedule one too.
Yeah, and we've moved those study sessions
Yeah,
around if we
We
need
move
to.
those around all over the place, so.
Okay, thanks.
Yep. Okay, see you. Good night.
Thank you.
Thank you.
Bye-bye.